So today, I'm happy to welcome Dr. Jennifer Merrill, who is an associate professor at Brown here in the School of Public Health. She's in the Department of Behavioral and Social Sciences, and her primary focus in research is investigating the etiology and consequences of alcohol use among young adults. She has several grants from the NIH, the National Institutes of Health, specifically from the National Institute on Alcohol and Alcohol Abuse, where she investigates drinking patterns, proximal antecedents, and consequences of both high-intensity drinking and alcohol-induced blackouts. She also looks into mobile delivered personalized feedback in terms of an intervention and how young adults who are not in a four-year college discuss alcohol and social media. So today we're going to be discussing her article that's called A Qualitative Examination of Contextual Influences on Negative Alcohol Consequences, Evaluations Among Young Adult Drinkers, published in the journal Psychology of Addictive Behaviors. So welcome, Dr. Merrill. It's really nice to have you here.
Thank you. Thank you so much for the intro.
Okay, great. So let's start with, talk a little bit about this project and why you decided to use a qualitative approach.
Yeah, so my dissertation work at the University of Buffalo really focused on how young adults think about the consequences of their drinking, but it wasn't something we knew a lot about. My mentor in graduate school actually developed a questionnaire to assess the consequences of drinking, but I was kind of seeing that it, by the time I got to postdoc, was already seeming a little bit outdated. So one reason I wanted to do some qualitative work was to really think about whether the measures were capturing all the consequences that college students and other young adults experience these days. Things have kind of transitioned over time to a more digital world, and I thought there could be different consequences that they experience relative to 10, 20, 30 years ago. So I think focus groups and qualitative work, for one, could be really good for generating survey items and making sure we're assessing things the right way. I also kind of had the sense that the way people thought about the consequences of drinking, whether they thought they're positive or negative, kind of really could vary. There was some research coming out that clinicians and researchers, we think all of these things that people experience after drinking, like vomiting and blacking out, are really negative, but the young people who are engaging in that level of drinking might not. So I wanted to hear straight from them what they thought about those consequences and all the nuances and how they perceive their consequences. Does having a hangover seem really bad if you have something to do that day versus you can spend the whole day in bed and relax? So really kind of wanting to understand how people think and how that might differ across situations. It's too hard to do with a single survey. So qualitative work seemed like the right way to go.
So you decided on focus groups as opposed to individual interviews for this. And can you talk a little bit about why that was better than doing individual interviews?
Yeah, I think a few reasons. I'd say one major pro of focus groups over interviews, and a reason I did it, was that you can get input from so many people all at once. So it's really just more efficient. So collecting lots of very rich data faster than if you were doing one-on-one interviews with each person. I also think focus groups have this advantage of allowing you really to observe in real time differing opinions. So you can see, does everyone agree on this, or is there some disagreement? And I don't know about you, but I actually encourage participants to disagree with one another at the start of the group, and tell them, we want this to be a conversation among you all, and I want to hear different opinions. So I think being able to observe that is a unique benefit of focus groups over interviews. I have used interviews in other studies, and I think there's some advantages there too. So if recruitment is slow or if people have really difficult schedules and you can't get them all in one group at the same time, sometimes the interview might be more practical. Um, or if the topic is really sensitive. So I didn't do this project myself, but I mentored a project focused on bisexual women with histories of sexual assault. And understanding their experiences seemed like something that was better to do one-on-one.
So, how did you find the interaction among your participants? It sounds like you had about 5 people that actually ended up attending these groups. And how did you manage that interaction to get the most out of it?
Yeah, that's a great question. I think there's always a challenge of like differing levels of participation. Um, so some people are going to talk a lot and have a lot to say and maybe even talk over other people. Other people might be very quiet. And that was something I had to kind of learn how to do. This was my first focus group project. So trying to pull out people that aren't talking as much and maybe um, try to tone down some of the people that were talking a lot. I think overall we had pretty balanced contributions in this study, but that is something I definitely find challenging.
It's always challenging. Being the traffic cop for the
Yeah.
conversation is very challenging, but it's a skill and you get better at it the more you do it, right?
Yeah. And I kind of say at the beginning, I want to make sure we get through all of the questions. So there might be times when I move us along. That way, hopefully, if we do have someone who's talking much more than everyone else, they won't feel offended if I try to redirect the conversation.
Yeah, that's good. Always prepare. That's excellent. So you managed to get 62 college students. Now, these were people who were underage drinkers, right? So, and they're from 4 different universities. And so you recruited men and women. So I have a couple questions about that. Number one, how hard was it to do that recruitment? Because recruitment is always such a challenge. And number two, because they were underage drinkers, did you worry more about confidentiality and things like that?
Yeah, great questions. So in terms of the challenge of recruitment, these days I am having a hard time, and I don't know if it's a post-COVID kind of difference in people's interest. I don't know what it is, but when I did this study, it was actually very easy to recruit. I think college students, fortunately for my research, though unfortunately for society, drink a lot, and a lot of them drink, so they're not hard to find. And they are typically interested in participating in research studies, even if it's just to make the money. So I did not have difficulties recruiting heavy drinking underage college students for this particular study. Um, I could see that some people might not want to participate in focus groups, being an underage drinker and having concerns about confidentiality. Those people probably just didn't respond to our ads, and therefore maybe our sample is biased toward the people that are more willing to take what they could see as a risk. Um, but for that study, we really didn't see any reluctance to participate. In terms of my own concerns, yes, I think at the time you had to apply for a certificate of confidentiality from the National Institutes of Health in order to protect their privacy and confidentiality. And we did go through that process. So we hope that we were able to reassure them a little bit more that unless you say something indicating you're going to harm yourself or someone else, what you say here will not be taken outside of the room by the research team. So hopefully we're able to reassure them about any of those concerns.
Did you use names at all in the focus groups? Did people refer to each other by name?
Yeah, that's a good question. So we asked people to come up with a pseudonym. So we had little name tags and they could come up with whatever name they wanted to use. it is possible. I mean, Rhode Island's a small community. It's possible that some of them did know each other or would recognize each other from classes, but we did recommend that they use pseudonyms and that they talk in the third person. So they didn't necessarily have to share their own experiences. They could say, I know someone who has a hangover every Sunday morning, or, they didn't have to admit that it was their self that they might be talking about.
That's a
Yeah.
good way to deal with that.
Yeah.
So if you had to, you also planned the single gender focus groups, right? And so talk a little bit about why you decided to do that.
Yeah. So, one, we thought, the topic being consequences of drinking, that those might differ between men and women. So, some research shows that women, for example, are far more likely to be victims of sexual assault, which has a strong link to alcohol use. And related to that, then we thought maybe the men would be more open talking about their consequences just in front of other men, and maybe women would be more open to discussing those topics around only other women. So part of it was there might be differences, and we want people to feel comfortable with one another. And we wanted the option to be able to examine whether there were differences in the themes from the focus groups. And if we had separate transcripts for men and women, I think that would make it a little bit easier to do. I don't know about you, but I was trained that with focus groups, the whole group is really your unit of analysis. So you're not necessarily pulling out what each person says as much as what came up in this entire group versus this entire group. So by separating the men and women, we could explore whether we were hearing different things overall.
Yeah, there are different schools of thought on that. So, you know, so that you could, to use approaches where you identify the people within the group and then separate them out on a number of characteristics. But certainly, having the whole group one gender simplifies that task big time.
Yeah.
So, do you have tips about facilitation? Like, what would you say to someone who was like running their first focus groups? What advice would you give to them?
Yeah. I think the biggest one is practicing. I've found that sometimes the way we first write the questions out on paper don't translate well when you ask them out loud. And if you can't answer the question yourself the way it's written, other people are going to have a hard time too. So I'd say practice is the biggest thing. I tend to start with something easy and a question that pretty much everyone can respond to kind of get them warmed up and opening up a little bit more. Um, I think this is something I learned from clinical work as well. I was trained as a clinician, and that was to be comfortable with silence. So giving people a minute to think and respond and not trying to fill that moment, which it is uncomfortable and hard sometimes. I think there's also a disadvantage to the fact that I was trained as a clinician and a psychologist in that, we really focused in my training on reflecting everything they say back and interpreting what the person is saying. And so with the focus groups, I think I had to try to stop talking so much myself and remind myself that, if I'm following up and interpreting what they're saying, that could change the data that they're providing to me. And I can only use what they say in their own words as data. I think if you are someone who's trained as a clinician, practicing, um, asking your questions and not really following up or interpreting anything that people say.
But I think those baseline skills are really valuable, and that baseline awareness of the group process, incredibly valuable
Yeah.
in doing a focus group.
Right. Yeah.
Now, you also had someone that you referred to as a note taker or observer in the room. And I'm just sort of wondering, what if you had to do these focus groups all by yourself? What if that person wasn't there? What would you be missing? And how useful was it to have somebody there in that role?
Yeah, that's a good question. So these days I am moving toward doing so many more things on Zoom, and I think I could potentially handle it. But at the time, the note taker really, when we're doing these in person, helped with a lot of other things. Like we have to meet the participants in the lobby and escort them up to the room, but we don't want to leave the participants that are already up there in the room alone. So having an extra person really helped with all those kinds of logistics, checking them in, checking their ID, answering questions that they have before we get started, and administering their compensation, their payment at the end of the group. So the note taker was really an assistant in all of those ways. Some of the things I think I would still benefit from having a note taker, even if I was running the group online, they helped kind of log the time that it was taking us to get through each section to keep us on track. And so that for the next group, we knew, section 1 took 30 minutes and we only have 1 hour. We need to speed that up next time. I think finally, the note taker can pay attention to things I might not be able to pay attention when I'm so focused on what's the next question and how am I going to redirect this person. So they might notice like someone else really looks like they want to speak up and they're not getting the chance. So I think having that kind of co-facilitator be able to call someone out and say, I think this person wants to take a turn was really helpful too. So that, their job really went beyond just taking notes.
Absolutely. I find them incredibly valuable because just facilitating focus group, you're juggling so many things to begin with
Right.
that it's very easy for it to get away from you. And
Definitely.
having someone else there, even just to help people who show up late, right? That doesn't necessarily interrupt the flow. Or if people have to use the restroom, they can assist them with that. So, yeah. So I actually don't know how people do an in-person focus group all by themselves.
I don't know.
That's really tough.
Yeah,
Really tough.
I was on another team where at one point we had four staff in the room, and I thought that was a little too much, honestly. I don't know that we want to overwhelm the participants and have lots of staff there, but yeah, I think having at least one other person is helpful.
Yeah, you don't want to have more staff than participants,
Right.
right? But that's where if you had a focus group room set up with a two-way mirror and things like that, maybe then other people could serve another purpose. They wouldn't be in the room. But those rooms are hard to come by. I don't think there are any at Brown, are there?
No, not that I've seen.
So the group that you was about an hour, to an hour and a half, it looks like, and you prepared questions ahead of time. Were you surprised at how much you were able to cover within the time allotted? How did that work out for you?
Yeah, in both the interviews that I've done and the focus groups, it always seems like I've initially tried to squeeze too much in to the agenda for the amount of time that we have. I think there's always variability from person to person and group to group and how much they talk, so it can be really hard to predict how much time you actually need to get all of your questions answered. I mentioned practice earlier. I think that's really helpful. And I mentioned having the note taker kind of track how long each section is taking. I usually, on the agenda for the focus group, do a lot, a set amount of time to each section and try my best to stay on track so that I'm getting to everything I want to get to, which could mean kind of sacrificing a little bit of depth to one section in order to move on to the next. Um, the other thing that I think about is I want my most important sections of my interview to come first so that I know I'll always get to those. And I often have a section or two at the end that's, if you still have time, ask these questions. So yeah, it never seems like enough time.
Always, always,
Yeah.
right? um, so You actually changed your approach as you went along because you noticed that you had reached saturation on certain issues, and then you decided to change how the focus group would occur. Can you tell me more about that?
Yeah, I think it kind of is along the same lines that we were running out of time to get to some of the things we were really interested in. And the first section was always, what are the consequences that young adults experience when they drink? And they had a lot to say about that. But there wasn't always new information coming up. We were kind of starting to hear the same consequences over and over. So I think what we did was decide to, okay, let's compile the list that we've heard so far, present it at the beginning of the group, and just ask, what are we missing? So in my mind, that was a good balance of still being open to the idea that there could be more data that we hadn't gathered, but also managing the amount of time we had and saving some time to get to other things in the agenda.
And how did the written exercises that you used, how did you find those? Were those useful?
Yeah, I think one value of having some written component is if you do have participants that are quieter in the group, it kind of gives them a minute to think about what they might want to say. And even if they didn't end up saying it out loud, we collected the worksheets that they filled out, and that just gave us even more data that we could work with. I looked back at the paper and I don't think I described it well, but what we did was we printed note cards with all of the consequences that we had gathered from the earlier groups. And we asked people to sort. We did a kind of a card sort activity where they, for each consequence, said, this would definitely make me think about changing my drinking. It might make me think about changing my drinking, or it definitely would not. So they're sorting these cards and then they're picking out which consequence they wanted to write about on the worksheet. So I thought that was a way to also keep them kind of engaged in the process. Um,
Did
and
they all have, did they each have their own set of cards that they
yeah,
were sorting? Yeah,
yep, they each had their own set of cards.
great. So then, to get to your transcripts, you obviously were recording um, your focus groups. I noticed you mentioned that one focus group, the recorder failed, and oh my gosh,
Mhm.
that's like the worst thing that can happen in a
I
focus group. Is like,
I
oh my
know.
gosh. So what was your approach to recording? And after that happened, did you change your approach?
Yeah, that was a sad day. So we used little digital handheld recorders. I was trained to have two in case the batteries died or in case one failed, and so that you could kind of place them at different ends of the table or different parts of the room so that you could pick up voices all around the room. So it wasn't a device failure, it was human error. I think I was probably nervous about running the group and paying attention to getting people checked in, and I totally forgot. I didn't start either recorder. So, yeah, after the group, we went back to my office and tried to recall, and the note taker, we had her notes, but it just wasn't going to be as great of data without the direct quotes from the participants. So now I mean, I think you learn from your mistakes, and I'm just much more sensitive to the fact that I need to start the recording. And in the agenda, I have big red bold letters that say start recording here at that spot in the protocol so I don't forget.
Good. And I actually, when I run a focus group, I have the observer handle the recording so that I don't I
That's
don't mess it up.
yeah, that's good. Or at least like remind me to do this if I forget. Yeah.
Right, exactly. That would be good too, because then you're both thinking about it.
Mhm.
Absolutely.
Yeah.
So your overall goal in this study was to generate hypotheses for subsequent quantitative studies. So how successful were you at achieving your goals? What do you think?
Yeah, I think the focus groups were super helpful in that regard. And, I have been reflecting on how much those groups really continue to inform some of the work I'm doing. So we didn't know much about how different contexts might influence whether consequences of drinking are seen negatively or not so negatively. But the results really pointed out to us all of the different things that matter and that do predict whether, or might predict whether a consequence is negative. So after that focus group study, I did do a survey study to test hypotheses. So we basically developed a questionnaire that asked people to think hypothetically, if this were the situation and you had this consequence, how would you evaluate it? So if you felt sick and vomited due to drinking, but your friends told you they had done that before, how bad would it be? If you were sick and vomiting and your friends thought it was funny, how would that impact you? Or if your friends told you that that had never happened or that they were concerned, we asked about all these different scenarios and supported the same things that we saw in the focus group study about the contexts that might influence consequence evaluations. Years after that, I also looked using ecological momentary assessment data, which is, if you're not familiar, basically collecting survey data in real time through an app as people go about their daily lives. So in that study, I asked people how they evaluate the consequences of their drinking closer in time to when they're actually having them. And I followed up on some of the things we learned in the focus group. For example, does how intoxicated they were impact how they evaluate the consequences? Or does their evaluation of consequence differ when we ask during the drinking event when they're actually consuming alcohol versus the next day? Because we had found in the focus groups that it might matter how much time had passed. And even now in the I know when you introduced me, you mentioned the mobile personalized feedback intervention. I decided that it would make sense to give people feedback about their drinking the morning after drinking because of what I learned in the focus groups, that's when they're going to feel the worst about what happened. So it might be an opportunity to intervene when they might be more motivated to make a change. So yeah, I think the focus group work was super informative and did inform lots of other stuff that I've done.
Yeah. I was really impressed with your use of theory, both in the planning and execution and interpretation of this, and that's something that's missing from some qualitative studies. And why did you focus on theory as much as you did?
Yeah, that's a good question. Maybe partly because the importance of theory was kind of drilled into my head in graduate school. So my training was in clinical psychology, and everything we did had to be guided by a theory. Qualitative work was really new to me, but why not have theory to inform which questions you're asking? So, yeah, I agree that that can be missing a lot of times in qualitative work, and that sometimes the value of doing the qualitative work is to develop the theory or to refine the theories. But yeah, I've always just seen theory as really important to all the work I do.
Absolutely. Well done. So, if you were going to do this study all over again, you're going to say, okay, I'm doing it all over again. Would you do anything differently? What would you change?
Start your recorder. That would be the main thing. Um, I think if I had the resources, the time, the money, it would have been cool to ask all the same questions of young adults who don't drink as heavily. So, we're learning about the consequences and how they evaluate them from people who are experiencing those consequences. But could I have run a subset of groups of people who had less experience drinking, and how do they think about those effects of alcohol? Um, in my work, I'm also really trying to move away from only studying college students. So I think it would have been cool to have a subset of groups of young adults who are not in four-year college. How do they think about all of these things? So I don't know about differently as much as I would have loved to do more.
Yeah, it's good. What's your advice, best advice to people who are brand new to doing qualitative research? What would you say?
Yeah. Um, I think one important thing when developing your interview guide or your focus group agenda is to really keep the intention of what you want to gather front and center. So I was trained to write intent statements for every section of my agenda so that even if I went off track a little bit with the line of questioning, the purpose behind the questions was still kind of top of mind for me. So I think that would be one big thing. I've said this a few times, but practicing, I think, before you actually run your groups is essential. And then I think just enjoy and appreciate everything that you can learn from people through qualitative work. I know I've told you before, Kathy, but not this audience, that I didn't receive any training in qualitative work in graduate school and didn't know how valuable it could be until I started doing it. So yeah, just enjoy and appreciate it.
You have the on the job training approach. Well, thank you so much for spending time with me today and talking about your study. This was really wonderful, and I really appreciate all the wonderful information that you've provided today. So thank you.
And thank you for the opportunity.